Good afternoon. Today we'll talk about pneumonia. We start.
I'm talk about the etiology, pneumonia in infants and young children, respiratory viruses such as respiratory syncytial virus, influenza virus, adenovirus, and pro-influenza virus, bacteria, especially Streptococcus pneumoniae, and Haemophilus influenzae type B, chlamydophila pneumoniae, and B. mycoplasma pneumoniae in older children. Pneumonia in young adults and middle-aged adults. Streptococcus pneumoniae is the most common cause of bacterial pneumonia in adults. Mycoplasma pneumoniae and chlamydophila pneumoniae are common causes of pneumonia in healthy young adults. Influenza viruses and other respiratory viruses, pneumonia in seniors and older adults. Streptococcus pneumoniae remains an important cause of bacterial pneumonia. Haemophilus influenzae, Legionella, Pneumophilia, and Staphylococcus aureus may also be involved. Respiratory viruses include influenza virus and respiratory syncytial virus. Pneumonia in immunocompromised people. In people with weakened immune systems, such as those with HIV, AIDS, organ transplant, or receiving chemotherapy, a wide variety of infection agents can be present, including bacteria, viruses, fungi, and parasites. Pneumocystis gyrovecii is a common opportunist fungus in people with HIV. Other opportunist bacteria, such as Mycobacterium tuberculosis, can cause pneumonia in immunocompromised people.
Clinical manifestations. The symptoms of pneumonia can range from mild to severe and include fever, shaking chills, cold, usually white flames, difficulty breathing, chest pain when you battle of cold, nausea or vomiting, and diarrhea. Symptoms may vary for different groups. Newborn and babies may not show any signs of infections. Others might vomit and have a fever, a cold. They may appear sick, lack energy, or be restless. Older adults and people with serious illness or where immune systems might have fever and milder symptoms. They may even have hypothermia. Older adults with pneumonia sometimes have sudden change in their states of consequences.
Pathophysiology by pneumonia. Pneumonia is an infection that affects the lung and can be caused by various pathogens, including bacteria, virus, fungi, and parasites. The pathophysiology of the pneumonia involves the invasion and colonization of the lower respiratory tract by this pathogen, leading to inflammation and tissue damage. The general pathophysiology process of pneumonia involves the following steps. Entry of the pathogen. Pathogen typically enter the respiratory tract through inhalation or aspiration, colonization, and infection. Once the pathogen reach the respiratory tract, they might colonize the upper airway or directly infect the alveoli, which are the tiny air sacs in the lung where gas and gas occur. Inflammatory response, the presence of pathogen triggers an immune response in the body. Immune cells such as neutrophils and macrophages are recruited to the site of infection to eliminate the invading pathogens. alveolar damage and coagulation. Inflammation in the lungs leads to the accumulation of fluid, inflammatory cell, and debris in the alveoli. This results in an alveolar damage and consolidation where the air-filled space in the lung become filled with the fluid and cellular infiltrates. Impaired oxygenation and ventilation. The presence of inflammation, fluid, and cellular infiltration in the alveoli hides the chance of the oxygen and carbon dioxide. This leads to impaired oxygenation of the blood and reduced the ventilation levels. System in effect is severe case of pneumonia or when the infection spreads beyond the lungs. System effect may occur the release inflammatory mediator in the bloodstream can lead to the systemic inflammation, fever, increased the heart rate, and the other sign of the systemic lines.
Treatment: antibiotics might be prescribed for bacterial pneumonia. Antiviral medicine is sometimes prescribed for viral pneumonia. Antifungal medicines are prescribed for fungal pneumonia. Over-the-counter medicine might be recommended to treat your fever and muscle pain or help you breathe easier.